Today, we are working to gain more understanding of the condition that caused the death of United States Senator Lindsey Graham. The late senator's office reported he died of an aortic dissection, a severe tear in the body's main artery, on Saturday, July 11th. The dissection was linked to arterial sclerotic cardiovascular disease, often described as hardening of the arteries. Well, joining us in this studio to help explain an aortic dissection and the symptoms that may appear and how people can reduce their risk is Dr. Sanford Ziegler. He's a cardiothoracic surgeon at the Medical University of South Carolina. Dr. Ziegler is also an assistant professor of surgery, and so we are so happy that he would join us. Very busy schedule to answer some questions. Certainly this is something that we have heard of. A lot of people might be hearing about this for the first time. So Dr. Ziegler, tell us, first of all, what is an aortic dissection and where on the body might this happen?
Sure. So the aorta is the main blood pipeline through the body. It's connected directly to the heart, and it starts right underneath the breastbone, and it runs all the way down to the belly button, where then it splits and goes to the legs. So an aortic dissection is where the inner lining of that artery gets a tear on the inside, and the blood pressure pushes the layers apart, and then those layers can go on to block off other parts of the body and block critical blood flow, or the aorta in its weakened state can rupture and cause internal bleeding.
So what are some of the most common warning signs of something like this? Is this something that happens, acutely, chronically? Could someone have felt something in their body change over time? What are the common symptoms?
So that it's usually not symptomatic until you've reached that acute, very dangerous situation of a dissection. A lot of dissections are result because of an aneurysm, and those tend to be asymptomatic. The most common symptom for a dissection is severe chest pain or back pain in between the shoulder blades. There's a host of other symptoms that can happen, such as stroke-like symptoms, or passing out, or sweating, or having pain or numbness in your arms or legs. So it's a very difficult diagnosis to make because of the wide constellation of symptoms it can cause.
Right.
But chest pain is the number one.
One of the other things that we're hearing a lot about, Dr. Ziegler, is hardening of the arteries. So now, is that something that would present with symptoms, and might someone notice changes in their body if they are experiencing that?
So hardening of the arteries is very, very common. It's related to high blood pressure and high cholesterol, and it is related to aortic dissections and aneurysms, but not as closely as it's related, as hardening of the arteries is related to things like heart attack.
Okay.
Does that answer your question?
Yeah, it
Good.
certainly does, because that's something that we're hearing with arterial sclerotic disease or whatever associated with the late senator. So who is at highest risk for this aortic dissection?
So the highest risk groups of people are anybody who has a family member who's had an aortic dissection. And sometimes we don't know that they had an aortic dissection. And when I operate on somebody who's had this kind of a problem, oftentimes later they say, oh, well, I had an aunt who died in her sleep and we just thought it was a heart attack. A lot of times those patients actually had a family history of aortic dissection and didn't know it. The other biggest risk factor is high blood pressure. More so than cholesterol and diabetes, high blood pressure is the real driver for aneurysm formation and dissection occurrence.
Is this something that someone can survive? We're hearing just so someone can survive an aortic dissection.
They can, for the kind that that Senator Graham likely had. About half the patients won't make it to the hospital. Of the ones that do make it to the hospital, you have about a 50% survival rate with just medicine in the first 2 days, which means it's a very dangerous condition. So surgery is really the mainstay of treating it.
Is there a screening mechanism in place, and how can people prevent something like this from happening?
So most of the aneurysms that we pick up that would go on to lead to a dissection are picked up sort of as a sideline. It's picked up when we're looking for something else. The people that really need to be screened and followed to prevent an aortic dissection are people who have a bicuspid aortic valve. That tends to lead to valve replacements in the family, and that does also run in families. So people who've had a lot of heart valve replacements in the family ought to talk to their doctor about getting an echocardiogram. And anybody who's had a family member that has had an aortic dissection or a sudden death that wasn't really explained.
All right, Dr. Sanford Ziegler, thank you so much for your time and for helping us gain more understanding of what may have in fact happened to Senator Graham. We appreciate your time.
Thank you so much.
And of course, we want you to stay right here with us. We are coming right back with more of News to Wit for after a quick break.